right. Thank you for that, Dr. Metziger. We know how challenging mental health has been for a lot of us during this pandemic. So we definitely appreciate that. So now we have come to the discussion aspect of this. I've seen a lot of questions that have been coming in from many of you. So we can now take time to go through the questions and, just have a discussion, answer some of the issues that are really have been on your mind. So I'm going to the top. One of the questions we had, we had a question earlier about does heat kill the virus? And we know Yema had already addressed that, and about people in warmer countries. So we won't talk about that again. One of the questions we have was, what is the recovery time for COVID-19? The recovery time is variable. We know that when people have mild disease, according to the WHO, you usually get better within about 2 weeks or so. But for people that get severe disease, it takes a long time, sometimes even 3 to 6 weeks to get better. There are people who are hospitalized for very long periods of time. And also, even after symptoms have subsided, some people still test positive for the virus for a few weeks. So it's variable, but it can last a couple of weeks. We have a question for, so that question was from Rahim. Thank you for that. Another question we have was over here from Khadija. Over here in the UK, Black and Asian people are more likely to die from COVID-19. However, the numbers aren't as high in African countries. Does this have something to do with the climate? Maybe Dr. Sharif, you can talk about some of those numbers in some of the African countries and what we're seeing. People getting infected in Sierra Leone and in other African countries.
So that's a good question. There is, the numbers do say that minority populations, especially in the United States, are at a higher risk of hospitalization and of death from COVID-19. We're not seeing the same being translated in African countries. And from my own personal perspective, I think it has to do with testing. If we're not testing enough people, then we're definitely not diagnosing enough people. And so I believe it's a surveillance problem. And if all the steps are being taken at these in these African countries, I think we will see similar situations. So I believe testing has to go up, the rate of testing, the availability of it. And if we can address those factors, then we can start comparing, cases and death rates, by country. But we're in Western countries are definitely reporting way more cases and, testing way more people than they are in Africa.
Okay. All right. Thank you for that. Another question we have from Comfort Bell. With more people going about their daily lives now, do you think the second wave would be much worse? And how can someone prevent themselves from that? And just for the panel in general, if there's a question that you feel that you want to answer, please jump in. Otherwise, I'll try to direct it to to one of you. This question about the second wave. One of the things I showed, was the Spanish flu that we had in the early 1900s. And in learning from the Spanish flu, you can see that there was a first wave that a lot of people got affected and died. And then their second wave was actually much worse, with a lot more higher numbers of infections and deaths. So there is that concern here with COVID-19 too, that a second wave might even be worse than the first wave. We are actually seeing, for example, in the US, after reopening, we're now seeing in many, many states, the numbers are going back up. For example, in North Carolina, they had the highest number of infections ever yesterday being reported. So we are seeing those indications. And for me, salon people, them, this now for remind una say, let we sit on our house. Let's not give up on those things that we're supposed to do. Where if you're gonna treat, wear your masks, hand washing, social distancing. Those things are going to become even more important.
Say something?
Yes, please.
Okay, so with the second wave, I mean, we do hear a lot about the second wave of the coronavirus and the implications it will have on different other things. But if the infection itself is immunizing, that means if you get corona and recover, if you're protected for a specific period of time, then we might not have a more gross second wave compared to the first, because then we'll have most people having come in contact with the virus and therefore cannot get infected or spread it to other people. So, but then it could be that you could get infected after being infected the first time. So if that's the case, and if social distancing is not being applied at all the levels, we will definitely, the possibility to see even more worse second wave is definitely there, and we can't discount it. We're hoping for the best, but we cannot say it's not going to happen, because after you get it, you might not, get infected again. So, but from a social distancing point of view, the less people you interact with, the less likely you are to come in contact with someone with COVID. The more people you interact with, the more likely you are. So personally, if you understand this, I think it should give you the impetus to, stay away as much as possible. I mean, we've done this since February or March, and I think what's left is shorter than what we've already been through. So you might as well just stay focused and continue social distancing until we can get over this. Thank you.
Yeah, thanks for that, Dr. Sharif. Next question, maybe Dr. Cole, you can take it. It's from Riyama Ndong. What are the COVID symptoms for kids? So talking about children. I think you're muted.
Okay.
Dr. Cole.
Can you hear me now?
Yes, we can hear you.
And so for most pediatric patients, the signs and symptoms are similar to adults in that it would be a severe disease, but that's if the child is presenting symptoms. There have been cases reported where children have developed multi-organ system failure. So they've had shutdown of their kidneys, shutdown of their cardiovascular system, similar to what quite a bit of the elderly population has been experiencing. It has not been as widespread, and they're still investigating as to why children seem to be less affected to it, but it is possible, and there have been cases of children infected with the COVID virus.
Yeah. Thank you for that. And talking about children, maybe Dr. Metziger can help us with this question that came in from Ezekiel Adekoka. What are the psychological effects of COVID-19 on children?
Yeah, that's a really good question. So, as I mentioned earlier, children's reactions are going to be largely similar to those that we as adults are going to experience. So, they're going to have the same fears about dying, they're going to have the same fears about their relatives. hundreds of thousands of cases in the United to go get a test themselves. They'll have fears about, not going back to school and what that's going to look like. So their fears are going to be largely similar to what we experience as adults. Our job is to, as adults, explain it to them and alleviate their fears in a way that's developmentally appropriate. So again, coronavirus, COVID-19, we're not going to pull up the CDC definition of it, right? We're going to talk to them about germs and about how we keep ourselves safe from germs. We're going to talk to them about death in a way that's not as morbid as, people are dying in the hospital and they can't say goodbye to their family members because they have to be quarantined and isolated to stay safe, right? You can talk to them about the circle of life and trees and how, leaves fall off the trees at a certain season and there's, a time and a place for everything. And maybe the earth is cleansing itself right now, right? So you just talk about natural processes that children can understand. If you are religious, you can talk to them about how God is in control, right? And how relatives, if they are the ones who are not fortunate enough to survive COVID-19, are in a better place, right? So the same language that you would use around death in any other situation, you would make it developmentally appropriate for the child in this way. And again, as I mentioned, modeling, right? So as we're getting anxious, how we calm ourselves down, we need to model for our children as we're striving to achieve that balance between, yes, everything is crazy and uncertain, but these are the things that we have control over that we can maintain some sense of normalcy, right? So we're going to keep our same routines and go to the grocery store, but it might look a little different now, right? We're going to have a play date with your friend, but it might be on the house party app or it might be on Zoom. So just alleviating their concerns in that way.
Thank you, Dr. Metziger, really very helpful. Maybe this next question, Mama Wa, that might be good for you to take this one. It's coming from Aliko Dangote. How does wearing the mask protect you from COVID-19? And you're on mute, so unmute yourself for a second.
So wearing a mask basically is really making sure that you protect you don't infect other people. So we encourage you wearing a mask because there are people who don't know their statuses or who don't know if they're infected already. So if they wear a mask, they're gonna protect the other person who does not have a mask. So that's basically how wearing a mask works. And that's why it's so important. Right.
Yeah, thank you for that. Really critical. We keep hearing this over and over again. Mask, 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 so important. So thank you for that, Mama Wa. This other question is, I think this one was sent to me. What is the treatment available right now for COVID-19? As we discussed, unfortunately, we don't have any drugs or vaccines that are specifically known to prevent or to cure COVID. However, we have symptomatic care. If you have low oxygen, you're in the hospital, we can give you oxygen. If there are some other complications, they can be treated. If you have a fever, we can bring down that fever. You have a pneumonia on top of that, that can be treated. There are experimental drugs like remdesivir, even the hydroxychloroquine that had all these controversy. There are many studies going around. Some of these drugs are helpful, some of them are not. Only time would tell, and we're hoping that pretty soon we're going to have something that's effective. But right now, supportive care, ventilation, oxygen, those are the big things we use, and preventing the complications, because COVID can affect many different organs in your body. So treating all of those different things is what helps keep you alive. The other question we have one from Aziz Kamara. Why is it so difficult for the scientists to have a vaccine for this COVID-19? Yema, I'm not sure if maybe you can talk a little bit about vaccines. What are the challenges we're seeing? Why is it taking so long to get a vaccine?
Sure. So it can be a number of things, but most importantly, I think it's important to remember that especially in the US, vaccines have to go through certain phases. They have to go through clinical trials. We have to be sure that when we give people these vaccines that is supposed to protect us against COVID, that it's not going to give us something completely different or make things worse. I mean, it's really important to make sure that the quality of the vaccine is going to do just that, is going to help either prevent us against COVID, or even if we do have the vaccine and we do get COVID, then it's very possible that the symptoms would be a lot less severe. And so that's one way to look at it, is definitely the clinical trials part, and making sure that it goes through all of the FDA procedures that it needs to go through. There's a lot of procedural loopholes. But then another thing to consider is that aside from the procedures, there's still so much uncertainty around just COVID in general. I think a lot of us are kind of learning as we're going about what this is, what it does when it leaves your body. And so that's going to really impact the way that scientists are moving in terms of making a vaccine, or having to go right back to the drawing board. So in short, there is still a lot of uncertainty. And I mean, I think people around the world are working around the clock on this, and not even just in the US, but it's brand new. It's brand new, essentially. And so still so much uncertainty and lots of research that needs to be done, but also the legal procedural aspects of getting a vaccine out.
Thank you for that. And we know they're racing against the clock. Usually it takes a couple of years to get a vaccine, but we're hearing it might be even a year or so. So everyone, believe me, I think, at the NIH, right. Everyone's trying hard to do the best that they can.
I think right now, a couple that I've heard of is Moderna, I believe, has gone through clinical trials, as well as Novavax. So those are two to maybe watch out for, and I believe there's one more. So it really just depends. Every day and every week it's changing.
Thank you for that.
Yeah.
So this next question, I think maybe all of us can take. We'll do a round robin. I can definitely start, but I think it's an important one, because I know a lot of us have family and our hearts are in Sierra Leone. This question comes from Comfort Bell. What is the most important thing for our African decision makers and country leaders to do during the crisis? I think, for me, our leaders have to take this seriously. COVID is here. It is something, it's affecting people with infections, with death, with loss of productivity, with affecting the economy. It is affecting us on a scale that we have not seen before. So we have to take it seriously. We have to put our resources. We have to make sure, I think it's a reminder for us and for African leaders, that you have to invest in health. You must invest in health because when you have issues like Ebola and you have issues like COVID, you show how weak and fragile your particular health system is. And when that happens, our societies, collapse to a certain extent. COVID had an extra layer where there are no flights going anywhere. People don't have anywhere to go. So if you have a health system that can't provide something as simple as oxygen, that can't test for certain diseases, you are going to see it impact our societies as a whole. So when we think of Sierra Leone in general, we have to strengthen our health system. We have to invest in health. We have to invest in strengthening our doctors, our nurses, our mental health practitioners, our hospitals. You look at an example of Burundi. I'm sure a lot of people have heard of this recently. The president is dead. most likely from COVID. His mom is dead. The people that are supposed to succeed him have COVID and are in the intensive care unit. So it is a wake-up call for us to strengthen our system. So, maybe we can go, I'm not sure who next wants to talk about this important issue for our leaders.
I can go next. Okay, thank you very much, Fatu. And I think this is a very, very important question or a comment. And, if the African countries pay attention, the other countries in the world that we rely on for aids, for different things to carry on our lives, they are taking this very seriously. They are putting resources into addressing the pandemic. Who are we not to apply the same respect to the situation, And basically what we see in, especially our country, Sierra Leone, is it's not just not treating Corona as a serious incident, but we treat everything related to, that's even similar to Corona with the same level of, I don't want to say on seriousness, but we just don't give it the level of effort that is required. And if we continue along this line, if we don't treat our medical personnel with respect, and I mean respect in the sense, don't send them out there without equipping them with the knowledge, the tools and resources that are needed to solve the problem. Because when you do that, you're exposing them to harsh conditions. They're seeing their people die in front of them and they can't do anything about it. That's not good for their mental health. It's not good for their families. And so I think, as a country, if we get together and take this thing serious and give it the respect that it deserves, we can address this. We can solve the problems that we face. But if we don't, I'm afraid we're going to keep seeing these things happen over and over again. So I hope that the current leadership, especially in our country, will take this seriously and address it, because we're not going to move forward if we have a pandemic. We're not going to have businesses running as smoothly as possible if we have a pandemic in the country. So that's my 2 cents. Thank you.
Yeah, no, you bring up very important points. When you look at our deaths in relation to the cases in our country and you compare it to the other countries in the sub-region, we have a higher rate of death. And that just reflects the strength of our health system. If this is not a wake-up call for us to finally strengthen our health system, I'm not sure what else there is. Are the other panelists, anyone wants to add to this question?
Yeah, Auntie Fatu, I definitely agree with you. Over there, and especially here, I think that what COVID really did was just emphasize and bring to light an already broken system. And I think that a lot of the controversy going on here with valuing the economy over lives, I think that because of those values in the first place, and without investing as much as we do in the economy into actual lives that are needed to run the economy, then we probably wouldn't have seen it as badly. So I think this is definitely a huge wake-up call. Are we going to strengthen public health, or are we going to keep trying to strengthen our capitalist society?
Yep, you're right. You make a good point. We're talking about the African countries, but even here, those challenges, those disparities, we're seeing those disparities with African Americans being more affected. But guess what? I work in maternal mortality prevention, and the same disparities we see in maternal mortality, in cardiovascular health, in mental health, all of those issues we're seeing in COVID. So it's a symptom of what we're not doing right. And COVID-19 pull we always not do. It pull we waste not do. Whether in America, whether in a salon, that's what's happening. We need to wake up. I see you shaking your head, Dr. Metzger. Yes.
Yes, I'm just co-signing your sentiments that it is an entire system that we need to pay attention to, that we need to fix, that we can't focus in on any one part of the problem without fixing them all, right? So how are we going to better identify cases? Are we going to do contact tracing? Don't forget the children, right? We say that COVID-19 affects children less. We need to make sure, is there a new strain? What does it look like, right? Putting continued emphasis on mental health as well as physical health, as well as our physiological responses, right? So just making sure that we as a community, we as a country are cognizant of not just the financial problems that a pandemic might cause, right? But also the psychological, intellectual, familial, societal toll that it might be taking on us.
Yeah, thank you. Mama Wa, any thoughts on this issue?
I think though, in terms of when you talk about health disparities, I think we have to focus on education, because I think when you look at, the statistic, you look at African Americans have all these comorbidities, hypertension, diabetes. So with that, I think we really have to focus on education. I do know that the healthcare system, it's unfair and it is what it is. But in terms on a personal level too, I think we can do better to make sure that we are doing the right things, like eating healthy, making sure that our blood pressures are within normal limits, diet control. So that's really something I think personal accountability. It's important also.
Yes. You raise a very important point. I truly think COVID-19 has affected us in the Sierra Leonean community in the US a lot. When you hear every other day, you hear about someone infected, you hear about people dying, and I think you're right, it's a way for all of us to do better around those things to improve our health. That you bringing that up just makes me remind myself that we need to give a shout out to our people on the front lines. In the US, we salon people that are really on the front lines. We have a lot of nurses. We have a lot of people working in care homes. We have a lot of people who are critical and frontline workers. We have police officers. So we have people that are going out there, doctors, they are saving other people's lives. And as a side effect, some of us do get infected. So just a reminder to thank our frontline Sierra Leonean workers who are on the front line. Dr. Denzel, Dr. Cole, your thoughts?
Yes, so for me, and seeing it from within a clinical perspective and then being forced to work telemedicine from home, at the beginning, it really didn't seem that something that would majorly affect us because it hadn't hit us yet. And I think that's one of the biggest things. When you see it across the sea over in China or a different country, you think, oh, that's bad, but it can never happen here. And then once it hits, everyone's scrambling. I think that's one of the biggest things that we can learn from not only this pandemic, but from this year at home, that you just have to be ready for what may happen, what can happen in the future, because we are not automatically immune or out of the way of anything at any given point in time.
You're right. Thank you for that. Dr. Cole, there was another question that came specifically for you. It said, okay. Could Dr. Cole please talk about the need for X-ray or CT scan for diagnosis in COVID?
All right, so when we're looking at X-rays and CT imaging, we're primarily looking for abnormalities of the lungs into where it doesn't look a proper healthy lung. And so one of the things that we look for is a consolidation or just kind of thickening within the lungs or fluid rather than air. One of the issues with COVID is that as a viral illness, it causes widespread consolidations throughout the lungs. And it's not only COVID that you can find it. If you have a cold, if you have a flu, if you have another virus, it can look very similar. And that's the reason why testing is so important, because these findings are what we would say non-specific. if I see an x-ray or a CT, I can tell you that the person may be sick and the person may have a pneumonia. I can't necessarily tell you if they have COVID versus another disease just from the appearance. As time progresses and we see more of these studies and we get a feel for it, we can probably say more definitively that this is highly likely to be COVID or suggestive of COVID, but just to take a picture and say that this person has it or not, it's one of those things that won't happen. Every day at work, I see studies of patients where it says positive COVID-19 and those scans and x-rays look normal.
All right, thank you for that. So we have another question from Poti Robinson. This is a testing question. Maybe, it's, should I get tested if I don't feel any symptoms at all, just to be on the safe side? I'm not sure if anyone wants to take that question.
I can take that.
Mm-hmm.
Actually, the Department of Health in Georgia is recommending everyone to get tested. It is important. If you don't know who have it, then you can isolate or social distance and then decrease the infection rate. So really, right now, I know for Georgia, in Georgia for a fact that you can get tested. You don't have to be symptomatic or anything. You just have to look on the DPH website and you can find all the addresses, the phone numbers of testing sites. And also you can look at the CDC website. You can find testing sites for other states too. It's all there. You can look for local or statewide and you can find that information.
Yeah, that's good. Thank you so much. I know that in the beginning we had limited tests and we were trying to ration tests, but now there's a widespread testing availability. So people should be able to get the testing much easier. Another question we have is from Khadija Kamara. What advice do you have for those that are dealing with cancer in Sierra Leone in regards to COVID-19? And I can take that, cancer, people with cancer are immunocompromised, meaning their immune system is just slightly weaker than everybody else. So they are in a high risk category. And if they do catch COVID, they can have more severe consequences for COVID. So really people that have cancer have to be more careful, more, stay home much more, isolate yourself, make sure the people around you are also, social distancing as much as possible, wearing your mask, washing your hands, all of those things that you can do to try to, decrease your chances of getting the disease, the infection. We had another.
May I say something additional to that?
Yes, please.
Also, if you have a chronic long-standing illness, fear of catching this disease is not an excuse not to seek the proper treatment. There has been reports of people saying that they've had chest pain or maybe that they feel weakness and they've missed strokes or heart attacks. And if you're just trying to pick one, you should always try to seek treatment for what you can.
Thank you. That's so important for bringing that up. We've seen, especially in the US, market decline in the numbers of people coming into the emergency room with appendicitis, with heart attacks, with things like that. And we know they are not going away. And you really could die when you don't seek care. I've had family members in Sierra Leone, who were scared to seek care and actually have had, someone die because they delayed getting care because of fear in COVID. So you may bring up a very important point, Dr. Cole, that we should still continue to seek care for when we have health conditions. I think there was one other question that I saw. I'm trying to find it. It was around testing. Oh, okay. So this is a question. from Khadija Kamara. Are hospitals in Sierra Leone equipped to handle COVID-19? I can answer a little bit of that question. I do know that there's been a lot of work put into strengthening some hospitals like Military 34 to be able to take care of COVID. Some of the other hospitals have also been strengthened. They've brought in ventilators. There's been a lot more training of physicians and nurses to try to provide care. So I do think that we are better able to treat COVID-19 now than we were a few months ago. However, the fact still remains that our health system has serious challenges where you can't get oxygen, in all hospitals, where there are still challenges with electricity. There are still very few doctors. Sierra Leone has some of the lowest numbers of doctors per population around the world. We don't have postgraduate training. So a lot of the doctors are general trained. We don't have, for example, intensive, we have in the US intensivists, doctors who are trained to take care of critically ill patients. We don't have that specialty there. We have, very few anesthesiologists, things like that. So overall, the health system does have challenges, but I do know that the Ministry of Health has been working to try to strengthen availability of care for COVID-19. All right. So any other, those are the questions that we've had come through so far. For the panel, are there any other things that maybe we haven't discussed that are important that you want people to know about, as we start coming close to rounding up this discussion?
Fatou, somebody has a question, actually. I'm just looking at it.
Yes,
it
please.
says, It says, is it dangerous to wear protective masks for too long? Because we keep hearing breathing in too much exhaled carbon dioxide has health problems. What would you say?
Yeah, that's a good question. So a lot of the masks you can breathe in and out. So cloth masks, you're able to breathe in and out, even the surgical masks and the N95s. For regular cloth masks, most people can wear them for prolonged periods, even for the regular medical masks. So I can give you an example. When I go to work in my clinic or at the hospital, when you get in, we put on that mask and you put it on for the whole day. The whole time, the only time you take off that mask is, for example, when you go into your office or into a quiet place, when you are eating lunch or you're drinking water. But you really do put it on the whole time. And for regular cloth or surgical masks, most people do fine because you can breathe in and out through the masks. Now, there are some masks, medical masks, like N95s, that they filter out a lot. It is difficult to wear them for prolonged periods. I put on those masks, for example, if I'm doing surgery, I might have to put it on for 2 hours at a time, but you struggle. So I do think that for the majority of the population, you can wear a mask safely for prolonged periods, but there are some more specialized masks that are difficult to wear for longer periods.
And Auntie Fatou, we should be, if we're wearing a cloth mask, should we be washing those after every wear? Is that correct?
Yes. So when you wear a cloth mask, for example, and you go out and you're talking to different people, it is possible that someone, COVID has virus particles that can land on your mask. So it's very important, for example, that you're not touching your mask and then you're taking it off and touching your face. you can get infected that way, or that you're not reusing a dirty mask. So it is important to wash your masks before reusing.
Would people maybe want to know like the effect of say the demonstrations since we were social distancing? You want to say something?
Yeah, that's a good one. You know, I think we spent a lot of time doing social distancing, staying at home, and then, you know, life happens, you know, and, you know, given what has been happening in the US, you know, people felt so strongly and so passionately that we wanted to go out and protest and share our frustrations. And you saw thousands and thousands of people going out. The problem with that, though, is, you know, we're not social distancing with those demonstrations. People are close together. Lots of people were not wearing masks. So there's really a big fear that, you know, we're going to see an uptick. Well, the uptick probably happened because of Memorial Day and Mother's Day. People started going out. So we're seeing some of that now, you know, but maybe in the future we might see an increase. So for Sierra Leoneans and for people in general, it's okay to want to go out to protest, but you have to try your best to be safe. Wear a mask, you know, try to distance yourself as much as you can, wash your hands, use sanitizer, things like that. But we do have to. COVID is probably our new reality for a long time. So we have to be cognizant in everything we do. Ask yourself, how can I make this safer? So that's a good point.
And also the effect of maybe, I don't want to say the demonstrations, but you will see maybe the effect not immediately, but maybe a month or 3 weeks down the road. So because, you know, the incubation period, if you get infected, you have to wait a little bit. So when we see cases go up maybe in the next week, you know, we got to think back what happened maybe 2 or 3 weeks ago. So
Yep.
I did hear that a lot of testing places, if you just mention over the phone that you have been protesting, then a lot of places are trying to get you in there as soon as possible. Because again, like you mentioned, racism is also a very deadly pandemic.
Yeah.
Right, and you would think that most people who are demonstrating are minority, and so it's just a getting effect. You're right.
We've had a few more questions come in. One is from Kathleen Sablotsky. Do you think it will be safe to travel at any point this year without a vaccine? And if we do, should we quarantine after? That's an excellent question. You know, I do think in general, we should try to minimize travel, but we know we can't minimize travel to zero. Some of the things that people are doing, for example, is, you know, it's summer, people want to, you know, they've been cooped up for so long, they want to take a road trip. Now, there's something called your quarantine bubble and the people in your quarantine bubble. Those are people, for example, I'm at home with my husband, my kids, my mom. Those are people that I'm at home with, and we've been sharing a space with without necessarily wearing a mask. Now, if I wanted to do a road trip and I rented a house and it's an Airbnb, and, you know, I'm going to that house and I'm trying to stay in that house and maybe go exercise, hike in the mountains, not be around a lot of people, not go to restaurants, eat at home, things like that. There is a way you can do things safely. Now, what's not safe is you might decide to go to the beach and join all those people having pool parties where there are hundreds of people and you're close together. Well, maybe that's not as safe. So there are ways that you can do things safely. There's a resource out there that was published that showed levels of safety. For example, you know, eating in a restaurant on the inside is not as safe as if you have to go to a restaurant. Well, if they have an outside space, there's, you're 6 feet away from another group of people where maybe that's better. So there are levels of safety, and you just have to look at what you can do yeah, go ahead.
Also regarding that, you should also be your own advocate for your own health and do things that make sense for you, not that other people are doing them, because at the end of the day, you're the one who will have to live with the effects and what happens. So if it takes a little bit more self-control to say, I don't need to go to the store 2 times a week, maybe just once a week, and buy more over the course of an hour, then that may be a decision that you need to do just to lower your exposure and lower the risk to your loved ones.
Yeah, that's a good one. We have another very good question. We're going to ask all the panelists. It comes from Abdul Hamid Dania. Assuming there is a vaccine in a couple of months, how many of you panelists would be willing to be first in line? I personally will be first in line. I want a vaccine. I want it desperately. I am confident that we have the safety measures in place with the NIH, with all the rigorous testing, that by the time they've done animal studies and phase 1 and phase 2 studies, and they open it up. But I'm a healthcare worker. I take care of COVID-infected patients. I have family members that are older that I don't want to get infected. I want to get on a plane to go to Sierra Leone and to travel the world. So I personally will be first in line. Panelists, what are your thoughts about the vaccine?
I'll get
I go forward, so.
Waiting?
I go forward first.
So, Mama, why you get forward? Please explain.
Well, because with all that's going on now, such like Aisha said, so much misinformation. I just want to make sure that they got it right before I go in for it.
So you want to see us go first, and then you watch to see how we are doing.
That's exactly right. And I'm going to give you guys a whole year to see how that's working for you.
All right. We heard what Mama said. Dr. Sharif, what are your thoughts?
I'll get the vaccine eventually, but my only problem is that the time, usually vaccines take a long time, and the sample size of the clinical trials are usually large. And we know for a fact that once the vaccine or medication goes to the market, all of a sudden the population size increases, right? So it's like a big clinical test. So with the time frame that is given for this new vaccine, I'm just a little skeptical. I mean, I'm uncertain, but I will get it if things, if it comes to it, because why not? I mean, I think it is really the only way we're going to get back to normalcy through a vaccine. So.
Yema, what do you think about this vaccine?
I definitely have to get it for work as a federal government contractor before I step foot back into that building. But I'm very familiar with the, anti-vaccination sides of the argument. A lot of it is deeply rooted in, again, racial tensions and just historically a lot of things that happened back then. So I get why a lot of people would be skeptical about getting the vaccine right away. I was just talking to one of my friends about this actually the other day. So personally, on a personal level, I'm going to be one of the first to get the vaccine, hopefully because of my job. And again, I think you have to think about how you want to contribute to getting back to normal, and not even just the new normal, but what do you, if there's a chance that I can help protect my family and my friends, then that's just something that I'm going to have to do, even outside of work. So I get why people would have reservations partially, but again, it's about also protecting the best interest of the public's health. So.
All right. Dr. Metziger, what about you? What do you think of this potential vaccine?
I'm excited about the prospect of a vaccine. I am overly cautious by nature. So just as I will be one of the last people to step outside of my house, I too will be in the second round of vaccines. So I'm going to see how you guys do out there in the world, going to restaurants and clubs and the movie theater. And then as you get vaccine, I'm going to, peek my head out and see how you're doing as well. And then, much like our return to campuses are being done in stages, I consider myself, kind of the intermediate, right? So I don't need to be the forefront and one of the first ones. But I do look forward to a vaccine, and I do look forward to, of course, being able to travel again and gather, right, without these major concerns. So,
Dr. Cole, what do you think about the vaccine?
For me, it probably isn't really much of a choice. I can see them requiring it, saying that in order to have patient contact, you have to have either so many negative antibody tests, either right before or an antibody or a vaccine prior to it. One of the opportunities that I do with Medicare assessments, they're starting back up with in-home assessments, and to start that, you have to have a antibody screen prior to even starting to go back to do that. So it's something where I think the more contact that you have, the more likely it's going to be a requirement. Whereas if you're more on the support role or not directly in patient contact, then it may be a little bit more optional.
Yep, thanks. And I think you can see from the panel, really, if you are in the front line, whether you're a grocery store worker, you're a nurse, a doctor, a policeman, those are people that I think you'll see a lot of those people really wanting to get the vaccine because they know they're at much higher risks. If you can stay home, and you're not required to be out, then you do have that luxury to kind of see how people do. But one of the things that I'm very happy about is that you see from this panel that whether we want to get it now, we want to get it later, a lot of us feel very positive about the vaccine. So for the Sierra Leone community, once we get a safe vaccine, we hope that you will be able to benefit from that. We had a few other questions come in. Is it true that the virus lasts on surfaces for longer than 6 hours? And I'll answer that. According to the CDC, we do have current evidence. Some studies have shown that the virus is called SARS-CoV-2. It can be alive for hours to days on some surfaces, on a variety of different materials. That's why it's so important to clean and disinfect surfaces, especially if you have someone at home that has the infection, making sure they are in, for example, one room and one bathroom that they use by themselves, cleaning surfaces, making sure they use their own plates and things like that, and don't share. All of those things that can help to decrease the spread of the virus. Another question we had, Tanya Lee had a question: how can we get healthcare professionals in Sierra Leone to participate in these discussions and information sharing process? That's a very good question. Actually, I am a part of groups of healthcare professionals in Sierra Leone, and I did share this information with them. A lot of healthcare workers now, our world is very connected. So I'm sure there are lots of people from Sierra Leone who are watching this, learning from this. But you bring up a good point, and maybe something we can talk about the organization, maybe what some of the goals are for trying to do some of these things. Can anyone address that? Around Salon Health, does anyone want to talk about Salon Health and some of the things that I know you want to do around sharing information. Today is an example of sharing information with the community, but I do know you are thinking of sharing information and mentoring and things like that. Dr. Cole or Yema, want to comment on that around the missions of the organization and where people can go to learn more about Salon Health?
Yeah. So for right now, we really want to encourage people to visit salonhealth.org. If you didn't get the link from one of us or who sent it to other people, then definitely go check out salonhealth.org. And we are a relatively new coalition. And so actually, as we're going along, we're going to be really making sure that we're honing in on establishing our mission, establishing our goals. And so like I said, it's relatively new, but we want to continue to have informational webinars, informational events, just really educating and strengthening our Salon American community here, all across the US, in Georgia, in DC, Philly, New Jersey. So please look for updates from us. I believe that there's a list going around. It should have been on, was it on the page?
Website, yes.
Salonhealth.org page. So please sign up to that listserv and stay updated periodically. Again, we're really new and we're still sort of just establishing it, but ultimately we want to make sure that we're strengthening our Salon community here and making sure that we're always keeping people up to date on what we know to help us move forward. Not just for.
Thank you for that. Salon Health, the organizers, I think this next question shows how critical it is to have an organization like this. It comes from Dr. Ahmed Sisse. I am a pulmonary critical care physician. How can I and other healthcare providers in the diaspora help the public health situation in Salon? Look, I just talk say Salon no get pulmonary critical care doctor, but we get all in America. I mean, so thank you for putting together something like this. This doctor can join this community. I know that some of the things that have been happening in Sierra Leone, for example, was Johns Hopkins University. We have a Sierra Leonean physician who works at Hopkins who helped organize training. The anesthesiologists and doctors at Hopkins trained doctors at Military 34 on how to use these the ventilators, machines like that. So we have, for example, a pulmonary critical care physician. And Dr. Sisse, please send me a message on Facebook and I can connect you with some of the organizations where you would be critical. You can have training sessions. You can have those exchange of ideas with doctors on the ground. So thanks to Salon Health for putting this together. Another comment along those lines by African Star. He said, it's good to see our diaspora community come together. Thank you to all of the organizers. And so we have a few more slides that we can just go to as we finish and round up this. There are a few more questions, but again, we will get to them, maybe answer them on Facebook in the comments. So maybe we can go to the last few slides as we just have a few minutes remaining. And we've done the discussion, and closing, I believe, is Dr. Cole.
All right. So thank you everyone again for joining us this evening. We hope that this information was useful and valuable for not only you, but your loved ones as well. This is not only a one-time adventure. We hope to provide future sessions and promote health and well-being of the Sierra Leone community. Please join us at our website, salonhealth.org. You can help us by donating or volunteering. We are also available on Facebook, Instagram, and Twitter. We welcome all in our initiative. Don't forget to like and subscribe this video. All feedback is welcome and appreciated.
All right, so go ahead, Dr. Cole.
Oh, and so a special thanks to our host, Dr. Fatu. We have a list of speakers, myself, Auntie Mamua, Aisha, Ed, Juliet, and our content developers. Really shout out to Dr. Heather Cole-Lewis, Dr. Yasmin Cole-Lewis, Ms. Hamida, Mr. Ndigi, Miss Minnie, Miss Novel, Mrs. Ani, Cardell, Aisha again, Ayat, Juliet, and Henry. There was so much work put behind what you guys saw today that this would not have been possible without any of them. And they're still keeping this machine going as we speak.
All right, so thank you so much to everyone, to you listening at home around the world. You know, we saw that we had people from many different countries here in the US, and I'm sure we had, I know we had people at home in Sierra Leone listening. Thank you to the organizations for putting this together, Salon Health, to all of the organizers. And to the panelists, you know, it really has been a pleasure to work with you and to interact. So thank you, everyone, and good night. Bye.
Bye, guys. Thank you so much for everything.
Bye.
Thank you for letting me be part of this.